My book of the week is The Wake-Up Call: Why the Pandemic Has Exposed the Weakness of the West and How to Fix It, by John Micklethwaite and Adrian Woolridge. As someone who has written a big book on what the world will look like after COVID, I probably shouldn't recommend somebody else's book, but I'm going to do it anyway. This is really a superb examination of the political and economic changes that should be ushered in by the pandemic. But since I mentioned it, you can also go to cnn.com/Fareed for a link to buy my book on the same topic. And now for the last look. The tiny kingdom of Bhutan, settled in the Himalayan mountains between India and Tibet, is known for its emphasis on gross national happiness over gross national product. Perhaps that's why it is one of the world's poorest countries, monetarily at least. So you may be surprised to hear that it has been one of the most successful at combating COVID-19. When the pandemic began, the country seemed ill-prepared and vulnerable. It had just over 300 doctors, but only one with ICU training, about 3,000 health workers, and a single PCR machine. That's all for a population of 760,000. It shared an open border with India, where COVID has killed over 150,000 people. Yet Bhutan only reported its first coronavirus death, a 34-year-old man with pre-existing conditions, this January. Bhutan achieved this feat through rapid early action, strong leadership, and a stringent public health response that emphasized compassion and unity. While tourism is one of the country's main industries, bringing in almost $90 million a year, it swiftly closed its borders. Mass testing, tracing, and social distancing were implemented. Hand sanitizer was distributed. Health workers were trained to use PPE and handle respiratory diseases. There were strict lockdowns and an aggressive 21-day quarantine policy. It is notable that three top government leaders, the Prime Minister, Health Minister, and Foreign Minister, are doctors or public health experts who call themselves the healthy government, and they relied on science when shaping their pandemic response. The Prime Minister, who is a surgeon, even slept on a window seat bench in his office throughout lockdown to avoid spreading the virus to his family, setting an example for the rest of society. The king also played an active role, visiting the front lines and fostering a sense of cohesion. In many respects, Bhutan is a lesson in preparedness, prevention, and detection. Even before COVID-19, Bhutan, working with the WHO, was preparing for a virus-borne emergency. In November 2019, the country ran a simulation exercise in which a passenger arrived from abroad with a suspected case of coronavirus. In January 2020, shortly after hearing of a mysterious virus outbreak in China, the country began screening arrivals at the airport and drafting a national response plan. From the first COVID case to emerge, a 76-year-old American who fell seriously ill, the country mobilized tracing and quarantining about 300 suspected contacts in just 6 hours. Bhutan is not alone in mustering its comparatively small resources for a more powerful response to the pandemic than the US and other wealthy countries. As Madeline Drexler notes in The Atlantic, Vietnam, Rwanda, and Senegal have all been more effective at suppressing COVID-19. All had similar policies of quick and early preventative action after prior experiences with epidemics. Perhaps it's time for us to learn from countries like Bhutan, to promote trust in government, focus on communication with the public, to take care of our whole society by providing better social and economic support, to work on preparedness and prevention in public health, and to address this crisis as a unified nation.